I'm going to be speaking about my Keystone project today called Yoga for Emotional Flexibility that I completed with Dr. Shannon Sauer-Zavala, who's a professor in the psychology department here at BU. So today in this presentation, I want to quickly outline the gap in the research that we sought to address, and then I want to create some working definitions for the tools that we utilized, including the unified protocol and yoga, and then I'll talk about the study that we conducted, and then I'll speak to some future directions that we have outlined. So in order to understand this gap in the research that we wanted to address, it's important to look to the rates of certain disorders. So for the sake of this presentation, I'll refer to emotional disorders. And emotional disorders encompass the range of anxiety and depressive disorders. So we know that 15% of individuals will have an anxiety disorder at some point in their lifetime, and that 6.7% of individuals will have a depressive disorder at some point in their lifetime. And in addition to these specific numbers, we know that these numbers are increasing for college student populations in particular. So as well as looking at prevalence of specific disorders, it's also important to note that people with an emotional disorder have a 75% chance of having another emotional disorder at some point in their lifetime. And we refer to this as a comorbidity, so someone who might have two disorders at the same time or different disorders throughout their lifetime. So we know that there are certain underlying mechanisms that are shared across these emotional disorders that lead to these high rates of comorbidity. We know these to be the tendency to experience frequent, strong negative emotions, as well as deficits in emotion regulation and the tendency to engage in emotional avoidance. So given that there are these shared mechanisms, here at BU, some of the researchers who I have been working with have developed a treatment to address symptoms across different disorders, and we call this transdiagnostic. So the unified protocol, which in this presentation I'll refer to as the UP, is a transdiagnostic treatment that addresses all of these emotional disorders. It was developed in response to these high comorbidity rates mentioned before, and it targets these certain underlying mechanisms involving how people experience their emotions. So the UP is a form of cognitive behavioral therapy, and it can be especially helpful for clinicians who may have limited resources, as they're able to address disorders at the same time instead of one and then the other. So the UP, it works by helping patients overall become more accepting of their emotional experience. So that's the overall goal. And it addresses these common difficulties that occur across the range of emotional disorders. So the UP has 8 components. The first component is an introduction, and the next module helps people become more motivated to want to seek out treatment. And then the next module is psychoeducation, so that people have greater awareness of what is going on for them and understand it a little better. And then the next 2 modules help participants develop some skills, both mindful awareness skills and then skills for helping them think more flexibly. And then the next component helps people prevent emotional avoidance and helps prevent them from engaging in emotion-driven behaviors. And then the next component involves exposure exercises and helping people face their fears, which may be specific to each individual, but whatever they have been avoiding or fearful of. And then the final component is just helping prevent relapse and create a plan moving forward for that individual. So just to change gears for a moment, so as I had been learning how my lab was approaching treating these different disorders, so I noticed many parallels between yoga, which I personally have been practicing for many years, and the unified protocol. And I noticed that both targeted this same mechanism of helping people work towards not engaging in emotion intolerance and becoming more accepting of their emotional experience, helping them increase their overall physical and mental awareness, and helping to not engage in judgment of oneself or of others. So in noticing these shared components, I wondered if there would be any way to test how they might work together. And then in addition to this, in recent years, I found through a literature review that there's been a recent increase in studying yoga in the setting of clinical psychology. So for my study, I wanted to assess the acceptability and feasibility of incorporating emotion-focused language into a yoga practice. So my hypothesis was that participants would respond favorably to this practice, as evidenced by high acceptability ratings, endorsing a willingness to engage in the practice in the future, as well as changes in mood from before to after the practice, and whether or not participants were able to enter a mindful state after completing the practice. So the process of taking this theory of how might yoga and the unified protocol work together and making it into, and actually applying it in a research study. So I got the unified protocol, the actual physical workbook, and I looked through the dialogue, and I took actual language from the UP and embedded it into the script of a yoga practice. And in this process, we found that a lot of the language really was amenable to being placed into a yoga practice, and it was very similar to things you might hear anyway. And so we were able to not really manipulate the language too much, but just add in maybe more of the emotion-focused language than you might otherwise hear in a traditional yoga class. So for recruiting participants, we wanted to work with a college-age population, both for feasibility and also because of the high rates of emotional disorders in this population, as mentioned previously. So we recruited from both BU Quickie Job Board and Facebook, and basically our inclusion criteria was just anyone over the age of 18 and who didn't have a medical condition that would preclude them from engaging in a beginning yoga practice. We had 25 total participants, 21 of whom were female, and they were aged 18 to 30. So the measures that we used to assess how participants were responding to this practice, we began before the practice. They had a demographics form and then the FFMQ, which is a mindfulness questionnaire that assesses state mindfulness. So what this means is how mindful people are on a day-to-day basis, not in any one specific moment, but how physically and mentally aware they are as they move throughout their everyday lives. And then we had the positive and negative affect schedule, which is a mood questionnaire to note how participants are feeling in a given moment. So it assesses both positive and negative affect. So after the yoga practice, participants completed the same mood questionnaire to note how much their mood had changed or stayed the same after engaging in the practice. And then a different mindfulness questionnaire that got at this more in-the-moment mindfulness. So how aware are participants in this exact moment after having completed the practice? And then we also had a qualitative feedback form that asked participants to rate how acceptable they found the practice to be, whether or not they would be willing to engage in the practice in the future, as well as several fill-in-the-blank sections that allowed participants to give feedback, anything they might want to change, as well as asking them for what they thought about the emotion-focused language and their main takeaways from the practice. So our procedure was that we conducted 45-minute pilot sessions of the practice with groups of up to 10 participants, and participants would complete the self-report questionnaires before the practice, complete the practice, and then complete the second set of questionnaires. So they were compensated with $10 Starbucks gift cards after completing the entire session. So overall, we found very high acceptability ratings, an average of 4.68 out of 5. And we did see as well statistically significant changes in mood, both increases in positive affect and decreases in negative affect from before to after the practice. And then we also found that the scores for the in-the-moment mindfulness questionnaire were what we would expect to find for participants of a college age who had just engaged in some form of meditative practice. And then additionally, we found that the fill-in-the-blank responses were very consistent with what we would want to find from someone who had just completed some sort of treatment with unified protocol or were familiar with the emotion-focused language. So I'll just read a few of the responses we got. So acceptance in where you are, free of judgment, focusing on sensations currently occurring instead of ones in the past, and to be okay with any thoughts or emotions and to just experience it and let it go. So these are all ideas that are very reflective of the main ideals of the unified protocol. So overall, we found strong preliminary evidence that supported our hypothesis that participants would find the practice to be acceptable and want to engage in it in the future, and that we also found that they were particularly receptive to this emotion-focused language. So just a few limitations to quickly outline is that we did not have a control group of just a yoga practice that didn't have any of the emotion-focused components. And then we also only had one session, and we did have a predominantly female population. So future directions would want to address these limitations by having a control group, maybe working with a clinical population or using this as a treatment instead of just having the pilot study, and maybe working on it in different settings. So, and additionally, I just want to outline that this might also be important because it could be a way to share the ideals of the unified protocol and the concept of emotional acceptance with people who might be more willing to engage in a yoga practice as opposed to a different form of treatment. So I just want to say a quick thank you, first of all, to Shannon, who's here, and the Best Lab, which is aptly named, for really being supportive in this, but also giving me so much autonomy. And I also want to thank my family who's here, and my friends who are all the best, especially two of them who I think could probably give you this entire presentation, and also the Honors College. Thank you. And I don't have a slide for questions, but if anyone has any questions, I think I have a few minutes. Oh. Yes.
Did you change the physical poses at all? I know you put in emotion-focused language, but did you also think about which poses or which kind of yoga practice would fit best?
That's a great question. So we actually discussed this recently in a lab meeting. We were talking about how if I were to work on this again in the future, I might want to have a more systematic approach. So I was building the practice, and it was a vinyasa practice, and I was designing which emotion-focused language to place within which posture. But there was not a systematic approach beyond me working on it, developing it, and then asking for feedback from my lab. So it wasn't more specific than that, but future iterations might seek to address that. So it's a great question. Nicole.
Yeah, so first of all, great job, and I've taken Danielle's class, it's awesome, highly recommend. So my question is, do you have any thoughts on how you might scale this up to make it something that's accessible to a lot of people? Like, do you think it's something that you could train yoga teachers to do during their classes? Do you see maybe doing like an online or app-based class?
Those are great ideas. Thank you if you want to work with me to develop them. So the practice itself, I wrote it out in a physical script that we sent to the IRB, and so I used the script each time to make sure I was being consistent over the course of the session, since every participant only experienced it one time. And so any yoga teacher could use this script, because the components that were reflective of the unified protocol were only based in the language, so it would just be adding in certain phrases or expressions. So definitely anyone could do it in that way. Connor?
Would you think in the future this would be like adjunct to additional forms of like psychotherapy, or actually more in the pharmacotherapy? Would you want people to do this while they were also on mood stabilizers and antidepressants and some of the other medications, or do you think this could actually be beneficial to actually wean people off some of these medications?
Well, looking at the approach of what the research says about applying cognitive behavioral therapy, I know that there's a lot of evidence for people who might be resistant to drug treatments working well with cognitive behavioral therapy, which this yoga practice is not, but it's including elements of the UP. So I don't know specifically how this practice would work with people on those things, and that's a great question, but I do think that the idea would be probably to have it as a supplement to other forms of treatment that someone was working with. Okay, no more questions. Thanks, Zach. Okay, great, thank you.